medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
One of the most important blood tests, but it's often overlooked or maybe just not understood by clinicians, is the PLAC-2 test, or PLAC-2 test, for basically assessing the cardiovascular system. Hi, I'm Dr. Mitch Ghen, and here's your weekly clinical update. Lipoprotein-associated phospholipid A2, or also known as the LP-PLA2 test, is an enzyme that basically binds oxidized LDL and therefore increases the risk of a patient getting an MI or a stroke. Remember, it's oxidized cholesterol that we're most interested in, not just plain cholesterol, which is an antioxidant. Now, if you couple this test with high-sensitive C-reactive protein, you're going to provide yourself or any other clinicians that you work with a formidable method for basically suggesting whether your patient has a higher than usual risk for a cardiovascular event. Now, PLAC-2 test represents friable plaque, not hard plaque, but plaque that could break off, dislodge, and get clogged in another small artery. And your intervention, in my opinion, is certainly going to be recommended if this test is positive. Now, I've never felt, and many studies support, that cholesterol in general is an antioxidant and not a large issue for our patients. But remember, cholesterol that does oxidize can create what's called a foam cell, if you remember back to your physiology, and it is a potential as a poor cardiovascular outcome particular marker. So this test is a great marker to put yourself and the patient into the right area for treatment. Now, once you demonstrate the presence of elevated PLAC2, you think, okay, what should be measured? Not the test itself, but measure the activity. The activity is the most accurate method for being able to determine whether the PLAC-2 test is an additional problem for your patient. It's measuring the enzyme that's converting oxidized fats per minute. So as it goes up and over the norm, you know that every minute oxidized fats are being converted and actually causing more plaque creation in your arteries. And then you can begin treatment. Anything that's greater than 223 nanomoles per minute per milliliter is considered abnormal. Remember, 223. The treatment could and should include at least one or more of the following type of things to help. First, natural lipid-lowering nutrients like panathine and L-carnitine. Niacin, curcumin is extremely important. You know it as the active ingredient in turmeric, and especially if the C-reactive protein is elevated, turmeric or curcumin, what I would suggest, is very important. A dietary response for your patient of fresh fruits and vegetables and a plant-based diet is also pretty much indicated as well. But you can also, if you need a drug to also react, the fenofibrates have been shown to help to reduce the LP-PLAC-2 test. Consider intravenous vitamin C for your patients if you do it, or referring them to someone who does, because that does reduce plaque inflammation and definitely improves the integrity of the endothelial lining, which is everything when it comes to pretty much cardiovascular health. If you want more information, please go to drmitchghen.com. That's drmitchghen.com. Thanks for watching.